So it's well, first of all, it's idiopathic, meaning it's balls of grapes called alveoli. Hello everyone, this is Dr. Jawad. I got an email the other day in regards to a gentleman. He has idiopathic pulmonary fibrosis, meaning unknown idiopathic pulmonary lungs fibrosis, meaning scarring. And it's progressive, which means there's no cure for it, and the treatments vary. But before I do that, if you're new to my channel, thank you for watching. If you haven't done so already, please hit the subscribe button down below, and right next to it is a bell notification. Facebook fans, always appreciate a growing audience. If you haven't done so already, please hit the like button down below. And if you find this information valuable, please share with a friend. I always appreciate a growing audience. Always appreciate it. Okay, so the email is, Dr. Jawad, I have a condition, it's chronic, idiopathic pulmonary fibrosis. Now, idiopathic meaning not knowing, pulmonary lung, fibrosis meaning scar tissue. And it is progressive, which means that in time it will get worse and worse and worse. Now, what is it? In our lungs we have, I always say we have a bunch of grapes, we have a bundle of grapes in our lungs called alveoli. And that's where when we breathe in, we take in oxygen through the lungs, and through the arterial system is the exchange of carbon dioxide and oxygen. Because we breathe in oxygen and we breathe out what? Carbon dioxide. Now the thing is, it's progressive. So it is progressive lung scarring. The cause is unknown. And in theory, some people say it could be autoimmune. It also could be from viral infections. It could be from smoking. It could be from heartburn. Don't really know. Thing is, over 5 million people worldwide have it, and it's more prone to people over the age of 50. Maybe because their lungs are getting older and the elasticity of those air sacs decrease over time. Now, the mechanism. So here's just my little diagram of the air sacs. So remember, we have the air sacs in our lungs. We have millions of them, okay? We have millions and millions and millions of air sacs. And when we breathe in oxygen, it goes into the lungs and it goes into these grape sacs, and that's where they expand and contract, and with the exchange of oxygen to carbon dioxide through the bloodstream, okay? Now these sacs they're lubricated, they have a surfactant, they expand, they recoil, we have an immune response in there, but the problem is, the mechanism, you get injury to the epithelial cells. Now the epithelial cells are the cells that line, they line on the inside, it's called the endothelium. And it triggers a repair response, which will release profibrotic and inflammatory mediators. Now, which means that, okay, pro-inflammatory mediators, this is your immune response. Something's wrong, let's attack it. This is your army. The problem is, it leads to progressive fibrosis within the lung parenchyma, which again, it's a lung tissue. So the alveolar epithelium becomes vulnerable to apoptosis, which is programmed cell death, inducing further epithelial dysfunction. The lining gets dysfunction, which means as well as the distortion of the structure and the function, meaning that the lining of the wall gets fibrotic, it gets scars, it gets hard, okay? It gets like cement. So what happens? You have a decrease of elasticity every time you breathe in and breathe out, which means that, okay, you're not going to be able to take in enough oxygen. It mimics other lung conditions, COPD, emphysema, things like that. The symptoms are overlapping. The primary symptoms is shortness of breath and a dry, persistent cough, because you're not getting a full breath of air in, and because you're having an immune response, you want to basically cough up the stuff, and you can't, and it's dry. The other one is weight loss, weakness, and fatigue. Why? Because you're just not getting the exchange of oxygen needed. So how do you diagnose it? You diagnose it through a high-resolution CT scan or bronchoscopy, also a lung biopsy. And the treatment protocol, you have it. So typically the treatment protocol is pulmonary rehabilitation, oxygen therapy, and also to stop smoking if this is the main cause. Gentleman was asking, he knows this because I communicated with him already. He knows all this stuff. He's doing all this stuff. But he's wondering what is the natural treatment. Now, the key thing is what you want to, the main motivation, the main focus is how can you increase the exchange in the lung tissue. You have fibrosis. You have scarring in the lung tissue. It's progressive, unknown. It will get worse. So you want to basically improve the mechanism of action. So the main goal is cod liver oil. Cod liver oil is phenomenal to decrease overall systemic inflammation, particularly in this case to the lungs. In addition, colloidal silvers. Colloidal silvers help eliminate the harmful fungus and viruses. Remember, you're having a response. Now you're more susceptible for viral infections or fungus. Amino acid, N-acetylcysteine, NAC for short. This is phenomenal to help with the oxidation, with help reduce inflammation, improve the mechanism. You want to take 1,500 milligrams daily. Turmeric. Turmeric's phenomenal for an overall anti-inflammatory because what you want to do, you want to reduce the amount of inflammation buildup in the lungs. In addition to alpha-lipoic acid. Alpha-lipoic acid is phenomenal amino acid. Now you want to take these on an empty stomach. It lowers the oxidative stress. It lowers the damage being done due to the mechanism of action. It improves the endothelial function. The endothelial lining of the lung tissue, even though yes it's scarred, you still want to sacrifice and make improvements on the lung tissue that's available. In addition to CoQ10. CoQ10 is a phenomenal supplement. It's good for muscle energy. It's good for heart. It's good to open up to dilate the airways in the lungs. 400 milligrams daily. In addition to antioxidant vitamins, vitamin A, vitamin D, vitamin C. Vitamin D is phenomenal for the immune response. Vitamin C is phenomenal for collagen synthesis as well as the immune response as well. So again, idiopathic pulmonary fibrosis, it is progressive. You got it, but here's a good way, a natural treatment for you if you have it. Thank you very much. If you have any comments, please leave them down below. I'll see you in the next video. Be good.